Assalamualaikum and good afternoon to everyone present today. I'm SHAZRINA ARIFFIN. I'll be presenting my study titled Development, Validity and Reliability of Questionnaire on Knowledge, Attitude and Practice, known as KAP, of preschool teachers towards vision screening among preschool children in Malaysia. Preschool vision screening has become essential due to increasing trend of visual impairment among children. Currently, in Malaysia, preschool vision screening has been carried out by optometrists since 2006. Due to the lack of trained professionals, a nationwide preschool screening program is still a work in progress. Involving teachers in screening program could be a solution to this issue. However, before implementing such program, KAP study is useful as it provides meaningful data for program planning and implementation. The aim of this study is to develop a valid and reliable questionnaire to evaluate the KAP level of preschool teachers towards preschool vision screening in Malaysia. Methodology of this study. The first stage is questionnaire development stage. At this stage, domain identification and item generation were carried out through literature review and discussion with research supervisors whom are experts in the field of pediatric optometry and visual impairment. Domain identified are knowledge, attitude, and practice. Next stage is content validation. 10 expert panels whom are ophthalmologists, academicians, public and private sector optometrists were involved. The values measured at this stage are content validity index for items, I-CVI, and content validity index for skill, SCVI. Following content validation is phase validation stage. This stage involved 10 preschool teachers where item clarity, appropriateness of fonts, and neatness of questionnaire were assessed. The next stage is construct validation, which is carried out during pilot tests on preschool teachers in Perak. Exploratory factor analysis was used. The final stage is reliability testing. Internal consistency was measured by using KR20 for knowledge domain and convex alpha for attitude and practice domain. Test-retest reliability was measured using intra-class correlation coefficient, ICC. Results of this study. Questionnaire development stage. 69 items were generated. Knowledge domain consists of 40 items, attitude domain consists of 15 items, and practice domain consists of 14 items. After content validation, 2 items were added, 43 items were revised, and 71 items were retained. The I-CVI value ranged from 0.8 to 1.0, while the SCVI value is 0.99. After phase validation, 3 items were revised and 71 items were retained. Overall clarity, appropriateness of fonts, and neatness of questionnaire were all agreed to be acceptable by the teachers. Construct validation. At this stage, the final draft consists of 68 items. Reliability testing for internal consistency. Knowledge domain yields a result of KR20 value 0.92, while convex alpha for attitude domain is 0.758 and practice domain is 0.856. Test-retest reliability gave an ICC value of 0.828 for knowledge domain, 0.676 for attitude domain, and 0.521 for practice domain. The final draft questionnaire consists of 3 domains: knowledge, attitude, and practice. Knowledge domain consists of 42 items with binary scale which will contribute to a total score of 42. Attitude domain consists of 12 items with Likert scale which result in a total score of 48. And practice domain consists of 14 items with Likert scale which will result in a total score of 56. All the scores will be converted into percentage, which will be used to evaluate the level of KAP among preschool teachers towards preschool screening. The classification of teachers' level of KAP will follow Bloom's cut-off point, where high KAP level is between 80 to 100%, 60 to 79% for moderate, and less than 59% for low. In conclusion, a novel questionnaire was developed for assessment of KAP level of preschool teachers towards vision screening among preschool children in Malaysia. This valid and reliable questionnaire is useful to collect important baseline data prior to new policy making in nationwide vision screening program implementation. Thank you.